Call the member for Wentworth.
Thank you, Mr Speaker. My question is to the Minister for Health. Will the Minister outline to the House how the Morrison government's plan to manage the health impacts of the COVID-19 pandemic has kept Australians safe?
The Minister for Health.
Thank you very much, Mr Speaker. And I want to thank the member for Wentworth, who knows and understands, through his international experience, the breadth and savagery of the coronavirus pandemic around the world. Over 35 million cases officially diagnosed and numerous more beyond that, inevitably. Over 1 million lives lost, as we predicted when we left this place the last time. And sadly, those numbers continue to grow and the real number would be far higher. Against that background, we know that around the world, the tragedies we've seen are extraordinary. In France, a death toll 1,400% higher than Australia. In the United States, 1,700% higher than in Australia. In the UK, 1,800% higher than in Australia. And in Spain, 1,900% higher than in Australia. We've had our sadness and our tragedy and our suffering here, and every life lost has to be mourned. But those international comparisons are powerful because they are sophisticated countries with highly developed health systems. And the reason, as a country, we've been able to achieve what we have, and we thank our health workers, our doctors, our nurses, our researchers, our medical professionals, all of those involved in the public service that have contributed, and all of the Australians, wherever they are, who have taken measures, as difficult as they have been, to protect themselves and to protect others. But the reason we have been able to do this is because we've had a clear, consistent plan. Since the 21st of January, when the Chief Medical Officer declared this to be a disease of pandemic potential. And that plan, which was formally released in February in terms of the Health Sector Emergency Response Plan for novel coronavirus, has been based on 4 pillars with regards to containment. The work with regards to our borders, which has seen international quarantine detect approximately 2,500 cases that would otherwise have come into Australia. Yep. The work in relation to testing, where over 7.7 million tests have helped Australia have one of the broadest and, according to the London School of Hygiene and Tropical Medicine, most accurate testing regimes in the world. And that's meant we could chase the cases. The tracing system, which in 7 out of 8 states and territories has been outstanding and which has now improved significantly in Victoria, and of course the distancing. And all of those things together have meant that, according to the Medical Journal of Australia, only yesterday the Australian plan helped save 16,000 lives. 16,000 lives has been the result on the basis of a refereed journal article, and that indicates that as a country we've worked together, we've striven together, we've saved lives together, and for that we say thank you.